Namaskar and welcome once again to Dr. Shruti's channel. Today's topic is a much sought after topic, that is PCOD or Polycystic Ovarian Disease. In order to help you out in this video, I'll try my best to summarize this vast topic in a short form. वीडियो शुरू करने के पहले मैं आपको ये याद दिला दूं कि अगर आपने अभी तक ये हेल्थ रिलेटेड चैनल डॉक्टर श्रुति's हेल्थ डाइट चैनल सब्सक्राइब नहीं किया है तो इसको ध्यान से हेल्थ और फिटनेस से जुड़ी जरूरी जानकारियों के लिए जरूर सब्सक्राइब कर लीजिए। तो चलिए दोस्तों शुरू करते हैं पॉलीसिस्टिक ओवेरियन डिजीज और पीसीओडी के बारे में। PCO or PCOD or PCOS, that is polycystic ovary or polycystic ovarian disease or polycystic ovarian syndrome, is a complex endocrine disorder which affects a number of endocrine glands in the body, which in turn leads to hormonal imbalance leading to various manifestations in the females. In today's lifestyle, it has become a rampant epidemic affecting almost 10 to 20% of the female population. Now coming to the causes. The cause for PCOD is not known up to date, but a number of genetic or environmental or lifestyle modifying factors have been implicated as its causative factors, which in turn lead to endocrine gland dysregulation, leading to hormonal imbalance, and this hormonal balance then is manifested in the form of increased insulin resistance and increased level of male hormones, that is increased androgen levels. Which age group might be affected? This disease might affect any age group beginning from puberty to the reproductive years to the premenopausal, menopausal, and it can even have serious health implications in the postmenopausal age group. Life-threatening. Is this a life-threatening disorder? No, it's definitely not a life-threatening disorder, but it's definitely a nuisance disorder. Coming to the symptoms part, the symptoms might be manifested most commonly in the form of irregular menstrual cycles. That is, the menstrual cycles might be delayed, or there might be scanty menses, or there might even be absent menses or heavy bleeding after a period of delayed menses. Infertility. In today's world, PCOD has become the most common cause of infertility or subfertility. It might also lead to miscarriages or repeated abortions. Then increased weight gain or central obesity. Weight gain leads to PCOD, and PCOD due to increased insulin resistance in turn leads to weight gain. So it becomes a very vicious circle to break. Increased level of androgen hormones, which is then manifested in the form of increased oiliness of the skin, leading to increased acne or pimples. Increased androgen levels again leads to hirsutism. That is increased hair growth on the face, chest, arms, upper part of thighs. That is the male pattern or male distribution of hair growth is there. Alopecia or hair loss from the head might be there. Acanthosis nigricans, increased insulin resistance leads to tags of skin growth, especially on the back of the neck. So specifically look out for the irregular menstrual cycles, increased weight gain or obesity, acne or hirsutism. These might very strongly point in the favor of polycystic ovarian disease. Long-term health implications. Yes, PCOD might have long-term health implications in the form of hypertension or type 2 diabetes mellitus because of increased insulin resistance, cardiovascular diseases, endometrial hyperplasia leading to endometrial cancer or the uterine cancer in later part of life. It can also lead to sleep disorders, increased cholesterol levels, hypertriglyceridemia, and also these patients are more prone to develop depression. Coming to diagnosis, the diagnosis is based on the medical history, the physical appearance of the patient, certain laboratory investigations where the hormone levels of the patients are assessed, and then of course the pelvic ultrasound examination
where we will find a ring of cyst follicles on the periphery of ovaries, from where it gets its name, that is the Polycystic Ovarian syndrome. Is it curative? No. Up to now, it is not completely curative, but it can definitely be very well managed. That is, the symptoms can be controlled with the appropriate treatment. Coming to the treatment options, the treatment depends on the age group of the patient, the symptoms of the patient, and most importantly, whether the patient requires fertility till date or not. In the treatment options, talking first and foremost about the weight loss or the lifestyle modifications. Weight loss. Weight loss is the single most important factor that can have a bountiful benefits in the management of symptoms of polycystic ovarian disease. If the patient can manage to lose as little as 10% of the body weight or as little as 3 to 5 kgs of the original body weight, and the weight is within the BMI or the body mass index, then it will have great beneficial effects in the management of symptoms by increasing the insulin sensitivity, which in turn will lead to increased ovulation, which in turn will lead to the regularization of your cycles and then the increased fertility. For weight loss, the patient should be put on a strict dietary plan in consultation with a dietitian, and also the patient should go in for the regular exercises. Diet and exercise, these should be a part of your healthy lifestyle if you want to avoid PCOD and if you want to manage PCOD. For the exercises, one can go in for the aerobic exercises like brisk walking, running, jogging, skipping, or the swimming, which will be of great benefit in the management of weight. Treatment options for the young unmarried females. For the young unmarried females, the main concern is irregular menstrual cycles and also the cosmetic appearance because of acne and hirsutism. Such patients can be very effectively dealt with the use of oral hormonal contraceptive pills, which will regularize their cycles and which will also help in curing the further acne and hirsutism. For the acne and hirsutism, you should consult a dermatologist or a cosmetologist. I have uploaded a separate video for the management of the hirsutism. That is 100% authentic method for treating hirsutism. For the young married females, the main concern is fertility. As I mentioned before, weight loss is the single most important factor in the treatment or in the management of symptoms. So first and foremost, you should try to lose your weight as much as 3 to 5 kgs. Then in consultation with a doctor or gynecologist, the patient can be put on certain insulin sensitizing drugs or even the ovulation induction drugs to enhance the fertility. But even if these not work and you have been suffering from infertility for quite a long time, then you should definitely go and visit a fertility specialist. And you might also go in for the surgical procedures such as laparoscopic ovarian rearing, which might help you in getting a baby. In the menopausal age group, as mentioned before, such patients are at increased risk of type 2 diabetes mellitus, hypertension, cardiovascular diseases, and also endometrial cancer. So go in for the regular screening test in consultation with your doctor. अगर आपको ये वीडियो पसंद आया हो तो अपने दोस्तों, अपने फ्रेंड्स, अपने रिलेटिव्स के साथ जरूर शेयर करिएगा। इस तरह से आप हो सकते हैं उनकी मदद करें, उनको सब्सक्राइब करने के लिए जरूर करिएगा। जल्दी ही मिलेंगे अगले वीडियो में। टिल देन, स्टे हेल्दी एंड स्टे हैप्पी एंड बाय बाय फॉर नाउ।